Hi all. My late husband's body would convert the carbs he ate to alcohol, and he would become legally intoxicated with ethanol levels 2 to 3 times the legal limit. My name is Michelle Giannato. I'm the Vice President and Patient Advocate for the nonprofit Auto Brewery Syndrome Information and Research. This video, the topic is attempted suicide. If this is a trigger for you, please skip this video. And I'll always warn you if there's sensitive material I'm going to talk about. Most of the people in our support group that have Auto Brewery Syndrome or ABS are sick anywhere from 5 to 15 years. They've been seen by multiple doctors and sometimes have been misdiagnosed from their symptoms because they do mimic other medical conditions. Patients who have auto brewery are vomiting and have diarrhea at least 8 to 12 times per day. They're passing out, they're having seizures, memory loss, hangovers, repeated pancreatitis. Sometimes their glucose levels are high and they might be misdiagnosed with diabetes. And one of the biggest red flags is they are in the ER and they have high alcohol, but they deny consuming any alcohol, so they don't know how their body has such a high level of alcohol. That usually cues a patient to start Googling, how do I get drunk without drinking? And then we pop up in their feed, right? We have Auto Brewery Syndrome. They reach out to us. They join our Auto Brewery Support Facebook group, and they ask, how do I determine if I have this? We recommend that they go out and purchase a fuel sensor breath alcohol meter and monitor their breath alcohol hourly after they consume a meal without carbs and with carbs, and keep a diary of their consumption of what they're eating and drinking and blowing. And if they blow positive after consuming carbs, it could be 1 to 3 hours, 5 hours, 12 hours. Each person ferments at different speeds. We tell them the likelihood that they have ABS is very high if they blow positive without consuming alcohol. Many in the group do that. And many of them are shocked to see that their breath alcohol meter is reading not only a positive number, but very high numbers, 2, 3, 4 times the legal limit. In those cases, in one way, they're relieved because they now have an answer as to why they were in the emergency department with such high levels of alcohol. And in another way, it's a letdown because this is a rare disease and they're already struggling with all these symptoms and they just want to get well. Once they get a home test done, meaning, they've purchased a breath alcohol meter, they've confirmed by keeping a diary and blowing positive in the meter, they start looking for a doctor and they ask us, where do we go? And we recommend, your primary, who knows you well and knows your medical. Gastroenterology, infectious disease are the types of doctors that this is in their wheelhouse, and they should pretty much be able to tell you and culture you like what strains of bacteria and yeast you have and what medications could be used to correct it. We also recommend meeting with a licensed nutritionist for diet so that they're not fermenting. When they start looking for a doctor, what they find is pretty much almost what I experienced, is that doctors are turning them away because they've either never heard of it, they don't believe them, or they're not willing to spend the time to research. So the patient becomes very depressed, angry, anxious, they lose hope. And while the clock is ticking for them to find a doctor, they could lose their job because they are fermenting alcohol on the job. When you lose your job, you lose your medical benefits. Some of them in the group have lost their house. Their spouses have left them and filed for divorce because they can't deal with the disease anymore. Some of them have lost visitation with their children or have lost their children. Some of them have been arrested and incarcerated with this condition. And their lawyers, even if the lawyer, their defense attorney believes them, the prosecution doesn't, and the judge doesn't believe them. And it's hard for them to get a defense if you can't find a doctor willing to try. That's when it comes up that maybe they're better off to just kill themselves. They want to relieve their family, themselves of the illness. The financial aspect is so overwhelming, the medical costs. My husband used to talk about maybe I'm better off without him. He would lay in bed and tell me he just wants to die. One woman found her husband with a gun to his head and she wrestled the gun out of his hands. And another man talked about how he's planning his suicide, but he doesn't want to do it until he figures out who's getting what and how his assets will be allocated. If you don't think having this disease is a big deal to a person's life, you're wrong. I don't know how else to ask our medical community to stop turning patients away. I applaud those medical professionals that willingly take on patients knowing very little about this medical condition. We will give you information on how to test, diagnose, and treat this condition. So please use us as a resource. We also have not one, but 2 studies going on right now for Auto Brewery Syndrome. And by you helping us, medical community, to diagnose these patients with auto brewery would allow us to enter them into these studies. We will partner with you and we will give you whatever tools that you need to succeed. We even have doctors readily available by phone. They will speak to you over the phone and walk you through what they have encountered and help you. They want to pay it forward, but we just need a bigger community of medical professionals willing to try. This is worldwide. It's not just in the United States. We have a lot of patients in the UK, Ireland. We have a whole community in Italy. We have patients in Australia. The list goes on and on. We are struggling to find doctors willing to help. If you go on our website, under providers, we have a list of those doctors willing to help. If you are one of those doctors willing to help, please reach out to us and we will add you to our website, autobrewery.org. Thank you.